Hi all, I am Dr. Leisha Fernando, Associate Professor of Biochemistry, currently working in Bharat Medical College and Hospital. It's a branch of Bharat Super Speciality Hospital. So initially, as everyone does, the schooling is going to be the same. From school you complete your 10th standard, and then in your 11th and 12th standard you prefer to take either pure science group or you take maths with biology group. So that if you take maths with biology group, it gives you options for choosing either medicine or engineering, right? So when I did my schooling, I took both with maths and biology. As far as my opinion is concerned, I would say it is always better to go for a maths with the biology combination, because we all think that in medicine it is only purely science. If you come to my department, in biochemistry, we have lot of calculations, lot of formulas which is involving mathematical calculations. So if you have a mathematical knowledge, it will be useful for us to do this particular subject. So similarly in community medicine also they use statistics and all. So it is always better to go for maths with biology, right? And then after finishing our 12th standard, when we joined medicine, it was entirely different process. We had to write the state entrance. Our 12th marks cutoff and the state entrance cutoff were calculated for 300, and we were ranked according to the community, right? But now it is totally different. Irrespective of your 12th standard marks, you have to just pass in your 12th standard, and you have to appear for NEET UG. So when you clear NEET UG and you get a higher score, based on that you are ranked and you come into a medical college. And after coming into a medical college, you start learning various subjects like anatomy, physiology, biochemistry. So my subject is in the first year. So not only biochemistry is a non-clinical subject, though we don't touch the patients, still we have a clinical laboratory which is associated with the hospital. So among the first year subjects, biochemistry is the subject which is associated with the hospital, where we have a central lab where we process the patient's blood samples and we release the reports. So based on the reports, it helps the clinicians to diagnose the patients, to treat the patients, to monitor the patients. So many things are being followed up with the help of our laboratory reports. So I am proud to say that we are aiding the clinicians in one way or the other. So we are in constant touch with the patients. So after I finish my MBBS, which is a 5.5 years course, then we have to prepare for our PG entrance. So it was a different scenario. Now we have to go for NEET PG. Once you finish your NEET PG, once you get your seat, you can, depending upon your preferences, you can go into any of the PG seats. So in the MBBS, the basic difference between your MBBS and MD is, MBBS, they will teach all the subjects. So you will have a basic idea, a preliminary idea. You will have an idea in all these subjects, right, from ENT, Ophthal, SPM, psychiatry, every medicine, surgery, OBG, but you will not master the subject, which means as a primary care physician, when you are sitting in a rural health center, you will be able to attend to the patient's primary healthcare needs, the basic ailments like your fever, vomiting, diarrhea, anemia, all these things you would be able to treat. But if you want to become a rural health center doctor or a primary healthcare physician, MBBS would be enough. But if you want to specialize in something, then you have to branch out. Then you have to do NEET PG. You branch out into a specialty. So I will talk only about my specialty. So I did the NEET PG. So we had a PG entrance, but now it is NEET PG. You have to prepare for that and you have to get into a college which is offering these courses. So MD Biochemistry, if you do, you have the opportunity for teaching medical graduates. So you will be a teacher. So it is we all know that medicine doctor is a noble profession and teaching is also a noble profession. So you do double noble profession here. You teach the students, at the same time you also aid the clinicians in releasing the reports and helping them to treat the patient wisely, right? So if you do MD Biochemistry, you can be a teacher. Now there is a lot of want for MD biochemistry. There's lack of people who's doing MD biochemistry, and various colleges are opened, and they are asking for MD biochemistry to teach the Indian medical graduates. So if you do MD biochemistry, one option is you can go for teaching. So you can go do a teaching, you can get yourself associated with the medical college and the hospital. So you have experience in teaching, at the same time you have experience in your laboratory well. Or else if you are not interested in teaching, you can go and be a consultant biochemist in a private laboratories which are NABL accredited labs. So it will be a prestige for you to get associated with such labs like your Lister, Hitech, Metropolis or Newburgh. All these are NABL accredited labs, even Apollo hospitals. In that cases, you can go there and you can get yourself registered there or work there as a consultant biochemist, right? And then if you're not interested in that, you can go in for research also. This field is highly favorable to do researches in molecular biology and the biochemical components. So we can go for so many tumor markers, the biomarkers which are helping to identify the diseases at the earlier stage is belonging to our field. So these are some of the job opportunities you will have. So if you are coming into a medical colleges, you will have the promotions from your senior resident. Then you can become an assistant professor, then you can become an associate professor, then you become a professor, and then you get into a professor and head. You can become the head of the department, or you can even occupy some administrative post, like how we are now currently working as deputy medical superintendent. We can have the administrative post, which will help us to have an idea about the hospital management system. When you become an assistant professor or an associate professor in a department of biochemistry in a medical college, when you are in the SR-ship, your salary will start from around 70,000, and then it gradually increases in your subsequent promotions to assistant and associates, and then you can earn up to nearly 2 lakhs per month, right? When you become a professor and head, it comes to 2 lakhs. So there are a lot of opportunities for us to earn, and at the same time we can also have our family time with the kids, because being a non-clinical specialty, you can have time to spend with your family members on your holidays and all. You can do turn duties on the holiday, you can come to the lab and release the reports, right? And then the one satisfactory thing in becoming a biochemist is you become satisfied. Though you don't touch the patients, you feel happy about releasing the reports and helping the clinicians to treat effectively, right? The patients are treated effectively with the lab reports. So if, for example, if you want to diagnose diabetes, only our laboratory fasting postprandial and our HbA1c values only will tell them the patient is diabetic. So the diagnostic criteria of diabetes is dependent purely on the laboratory values. So we are happy and we are proud to say that we are able to help the oncologist in identifying the cancers, in treating the cancer patients, in assessing the prognosis of the cancer patients. So many fields, it is when you talk about a chronic kidney disease patient, the elevated urea creatinine values, and after dialysis the values coming down. So we are actually helping the clinicians to do well in their treatment part, which means our values are totally so helpful to those clinicians, and not only to the clinician, to the patients. When there is improvement in the patient's clinical condition, looking at the values, it makes the patient happy, it makes the clinician happy, it also makes our biochemist happy. So with that, I wish all of you very best for your exams, 12th standard exams and your NEET examination, and I hope all of you will come out in flying colors and try to get into a medical college, because many of the people's dream is to get into a medical college and become a doctor.